If you're taking ashwagandha right now, or you've been thinking about trying it, stop everything and listen to this. Because while the internet is flooded with people calling ashwagandha a miracle supplement for stress and sleep, there are recent studies showing something very different, something that could quietly damage your liver or send your thyroid spiraling out of control before you even realize what's happening. And the scariest part? The damage can start in as little as 2 weeks. Welcome to Care on Health. I'm Dr. William Lee, and what I'm about to share with you today could save you from a serious health crisis. Yes, ashwagandha has some genuinely impressive benefits backed by real science, but there's a dangerous side to this supplement that almost nobody is talking about, hidden risks that the supplement industry doesn't want you to know. Today I'm going to walk you through the latest research, not just on the benefits, but on the potential toxicities that are starting to show up in medical journals around the world. I'll tell you exactly who should never take ashwagandha, the medication interactions that could cause your blood pressure or blood sugar to drop to life-threatening levels, and if you do decide to take it with your doctor's guidance, I'll show you the safest dose, how to cycle it properly, and how to choose a brand that won't poison you with contaminants or fake ingredients. Before we start, I need to be clear. Even though I'm a physician, I'm not your physician. Please talk to your doctor before making any changes to your health regimen. Everything in this video is educational only and not medical advice. Now let's talk about what ashwagandha actually is and why it's become so incredibly popular. Ashwagandha is an adaptogen that's been used in Ayurvedic medicine for centuries, and in recent years it's absolutely exploded in the wellness world for its potential to reduce stress, improve sleep, support brain health, and provide neuroprotection. There are small studies suggesting that ashwagandha can help with exercise recovery and muscle growth. It may help balance hormones. The research is actually quite promising, especially when it comes to sleep quality. We have a systematic review and meta-analysis that included 5 randomized controlled trials with 400 participants total. It showed a clinically beneficial effect of ashwagandha extract compared to placebo in improving sleep. The effects were seen in areas like total sleep time, wake time after sleep onset, and sleep efficiency. The most prominent improvements were seen in adults diagnosed with insomnia who took doses of at least 600 milligrams per day for at least 8 weeks. That's significant. But here's where we need to pump the brakes. There were some notable limitations to this meta-analysis. 3 of the 5 trials included in this study used actigraphy to objectively measure the quality of participants' sleep. Actigraphy is basically a method where participants wear a wearable device on their wrist or ankle, and even though actigraphy is widely used in sleep studies, it doesn't actually directly measure your quality of sleep. It measures movement, which is then used to estimate your sleep and wake cycles. Ideally, the gold standard assessment for sleep would be done with a test called polysomnography, which is more expensive and is done in a laboratory setting. And another limitation, the sample size in all of those studies was pretty small, and the duration was limited to only 8 weeks. Now, a lot of people take ashwagandha specifically for anxiety. And we have a systematic review and meta-analysis of 9 randomized controlled trials involving over 500 patients. It found that ashwagandha formulations had a significant beneficial effect on measures of anxiety and serum cortisol levels when compared to the placebo group. That's impressive. There was also a study that looked specifically at the safety parameters of ashwagandha. It found that taking ashwagandha up to 300 milligrams twice a day for up to 8 weeks did not show any adverse effects on hematologic and biochemical parameters. Sounds great, right? But here's my concern. Most trials that looked at the effects of ashwagandha were fairly small with very limited sample sizes, and they only lasted 6 to 8 weeks maximum. What happens after 8 weeks, after 6 months, after a year? We simply don't have that data, and this is where things get concerning. Let's talk about the most serious safety issue you absolutely need to know about. Liver toxicity. This is the most serious and well-documented complication associated with ashwagandha, and it's known as herb-induced liver injury. This liver injury was first mentioned in medical literature in 2017 with a case report of a 20-year-old man in Japan who developed severe intrahepatic cholestasis. That's basically a condition where bile can't flow out of the liver properly. This blockage leads to a buildup of bile acids in the liver and in the bloodstream, which causes severe itching of the palms and soles of the feet, dark urine, pale stools, and in severe cases, jaundice, which is yellowing of the skin and eyes. Since then, there have been multiple case reports from the United States, Europe, and Asia that have directly linked ashwagandha to liver injury. And here's what's really concerning. In most of these cases, researchers were able to analyze the chemical composition of the supplement that was consumed, and they ruled out contamination with toxic compounds. So it wasn't a bad batch or outside toxins, it was the ashwagandha supplement itself that caused the damage. When you take a deep dive into those cases, the shortest reported time from the first dose taken to the onset of symptoms was only 2 weeks. 2 weeks. There's another case from Iceland where the first symptoms didn't appear until after 12 weeks. So the damage can happen fast, or it can build up slowly over time. So what's actually causing this damage? The specific substance suspected to be responsible for these liver-damaging effects is one of ashwagandha's metabolites called withafrin. A recent study revealed that withafrin can cause DNA damage in liver cells, especially when the body's natural detox systems are overwhelmed. Normally, we have a natural chemical called glutathione that neutralizes and removes harmful substances like withafrin. But when that system gets overwhelmed, the damage can build up fast. This is why taking ashwagandha can be especially risky for people with poor liver function or for those taking other hepatotoxic drugs, even something as common as Tylenol. Now, these cases are scary, but they're still relatively rare. However, even rare side effects matter when the consequences are very serious and potentially preventable. So the way I would approach this, I would definitely stay away from ashwagandha if you have any pre-existing liver conditions like hepatitis or fatty liver disease. And I would be extremely cautious if you take other medications that may have toxic effects on the liver. That includes drugs like Tylenol, many antibiotics, statins, and other supplements, like green tea extract. If you were to start ashwagandha, I would make absolutely sure you have your liver labs checked 4 to 8 weeks after starting the supplement. And I would monitor your liver function periodically, probably at least every 3 to 4 months during the first year. This is not optional. This is essential for your safety. Next up, let's talk about thyroid function. This is another area where ashwagandha can cause unexpected and potentially dangerous changes. In some cases, ashwagandha may increase both T3 and T4 thyroid hormone levels. That might sound helpful if you have low thyroid levels, but it can push healthy thyroid function into overdrive, triggering hyperthyroidism. There are case reports of people developing heart palpitations, severe anxiety, headaches, diarrhea, and insomnia after using ashwagandha, only to discover their thyroid labs were completely out of range. For those people, the average time for symptoms to appear was 2 months after starting ashwagandha, and that delayed onset is part of the danger. By the time symptoms show up, the damage is already happening. Your thyroid has been overproducing hormones for weeks, potentially straining your heart and nervous system. So if you have any thyroid issues, hypothyroidism, hyperthyroidism, Hashimoto's, Graves' disease, I would be extremely careful. And regardless of whether you have pre-existing thyroid conditions, I would monitor your thyroid function very frequently, especially during the first 3 to 6 months after starting the supplement. Get a baseline thyroid panel before you start, then recheck it regularly. Now let's talk about something equally important, how ashwagandha interacts with other medications you might be taking. This is critical and often completely overlooked. If you're on blood pressure medications, ashwagandha can actually amplify those medications' effects, which can lead to dangerously low blood pressure. We're talking dizziness, fainting, falls, potential injury. Ashwagandha can also lower your blood sugar levels. This is especially concerning if you're on diabetes medications, and particularly if you're taking insulin. That combination can cause an unsafe drop in blood sugar, leading to hypoglycemia. Symptoms include confusion, sweating, rapid heartbeat, shakiness, and in severe cases, loss of consciousness or seizures. You also have to be very careful with sedative medications and anti-anxiety medications. Ashwagandha has calming effects, which sounds great, but when combined with benzodiazepines like Xanax or Ativan, or sleep medications like Ambien, it may cause excessive sedation or even respiratory depression. That means your breathing could slow down to dangerous levels, especially during sleep. And here's something people don't talk about enough. Some individuals report emotional blunting or emotional numbness while taking ashwagandha. They feel less stressed, but they also feel less of everything else. Less joy, less connection, a kind of flatness that can affect relationships and quality of life. And finally, I would definitely not use ashwagandha if you're pregnant or breastfeeding. We have virtually no safety data in that population, and there are some animal studies suggesting potential risks to fetal development. All right, I don't want this information to scare you away from ashwagandha entirely. It is an incredibly powerful supplement with a lot of genuine therapeutic benefits. The vast majority of people do very well with ashwagandha and experience significant improvements in stress, sleep, and overall well being. But you do have to be smart and cautious when you take it. This isn't something you just grab off the shelf and start popping without a second thought. So if you're going to take ashwagandha, discuss it with your doctor first and keep these guidelines in mind. First, the dose matters tremendously. Most clinical trials use doses of 300 to 600 milligrams per day. I would be very hesitant to take anything higher than that. Higher doses don't necessarily mean more benefits. They just mean more potential for side effects and toxicity. Second, since most studies we have on ashwagandha had pretty short durations of no more than 8 weeks, and we don't have any long-term safety data, I would actually recommend taking breaks from ashwagandha. Cycle on and off every 6 to 8 weeks. This gives your body time to recalibrate and may reduce the risk of side effects and toxicity, building up slowly in your system. Third, and most importantly, do not take ashwagandha if you have any liver issues whatsoever: hepatitis, fatty liver disease, elevated liver enzymes, history of liver problems, any of it. Don't risk it. And I would be extremely careful with ashwagandha if you have an underlying thyroid issue of any kind. The potential for it to disrupt your thyroid function is real and well documented. Even if you don't have any of those conditions, I would get a baseline set of labs to measure your liver function and thyroid function before starting ashwagandha. Then while you're on it, I would recommend monitoring your labs at least every 3 to 6 months, depending on your other health conditions and risk factors. And probably one of the most overlooked but critically important decisions you have to make is picking the right supplement. Unfortunately, the supplement industry, at least in the United States, is not well regulated. The FDA doesn't pre-approve supplements before they hit the market, so the quality and purity of the products you get can vary wildly between brands. When you're looking for a brand, look for labels that say NSF certified or USP verified. These indicate that the product has been third-party tested and actually contains what it claims to contain, and that it's free from contaminants like heavy metals, pesticides, and microbial toxins. I would also avoid proprietary blends that say something vague like ashwagandha complex without specifying exactly how much of the actual active extract is in it. That's a huge red flag. The dose is critically important when it comes to ashwagandha. Just like with medications, the dose makes the poison. Also, you need to be very careful with ashwagandha gummies. There are way too many wellness brands out there that throw a sprinkle of ashwagandha into a gummy full of sugar and call it a stress solution. With most gummies, you're not getting anywhere near therapeutic levels of ashwagandha, and these gummies often lack standardization or third-party testing. Now, that's not all gummies. There may be some reputable brands out there making quality gummy products, but most of them, they're more candy than supplement. Look for products that clearly state the percentage of withanolides, which are the active compounds in ashwagandha. A good quality extract should contain at least 5% withanolides, and ideally closer to 10%. And by the way, if you do take ashwagandha, let me know in the comments which brand you're taking and how it's working for you. I'd love to hear your experiences, and I think it would be really valuable for everyone watching to learn from each other about which brands are trustworthy and effective. So let me summarize everything for you. Ashwagandha can be a powerful tool for managing stress, improving sleep quality, and supporting overall health. The research is promising, especially for anxiety and insomnia, but it's not risk-free, and it's definitely not for everyone. The most serious risks are liver toxicity and thyroid dysfunction. These can develop within weeks or months of starting the supplement, and they can be severe. If you have any pre-existing liver or thyroid conditions, or if you're taking medications that affect these organs, you need to be extremely cautious or avoid ashwagandha altogether. If you do decide to take it, work with your doctor. Get baseline labs. Use a reputable third-party tested brand. Stick to evidence-based doses of 300 to 600 milligrams per day. Cycle on and off every 6 to 8 weeks, and monitor your labs regularly, especially during the first year. Pay attention to how your body responds. If you develop any symptoms like persistent fatigue, dark urine, pale stools, itching, yellowing of the skin or eyes, heart palpitations, anxiety, or unexplained weight changes, stop taking ashwagandha immediately and see your doctor. Remember, natural doesn't automatically mean safe. Ashwagandha is a powerful compound that affects multiple systems in your body. It deserves respect and careful use. If this information was helpful to you, let me know by typing yes in the comments and tell me where you're watching from. I love connecting with viewers all around the world who are taking an active, informed approach to their health. Share this video with anyone you know who's taking or considering ashwagandha. This information could literally prevent them from serious liver or thyroid damage. If you want more evidence-based health information that cuts through the hype and gives you the real science, subscribe to Care on Health and turn on notifications. I post new research-backed content every week to help you make informed decisions about your health. Thank you for watching. I'm Dr. William Lee. Take care of your body and use supplements wisely.